Imagine your patient is very angry, shouting at you and refusing for the treatment. Now the interviewer asks you, what will you do as a nurse in this particular situation, or how do you handle this situation? Hello, good evening fellow nurses. This is very common question which generally being asked in most of the nurses interview. And most of the nurses will say, I will call to the security or I will inform to the doctor. I would say this is not a correct answer. Why? Because it lacks empathy. So today in this video, we are going to discuss how you can answer such type of question. So let's first understand what category of question is that. See, this is a behavioral category. What is behavioral category? Basically, behavioral categories are those categories where your technical knowledge is not required, but yes, your behavioral ability, that how you are able to understand the other patient conditions or how you are able to modify the situation. Or generally we say that how do you work under pressure, because see, these type of situations where patient is very angry, patient is rude to you, patient is uncooperative, shouting at you, relative are shouting at you, these situations are quite common in the hospital scenarios. So that's why interviewers are asking you this question to understand whether you can handle such type of situation or not. So let's find out. So today I am going to discuss 5 basic points which you have to use to answer such type of question. Number 1, stay calm. It's very easy. Try to stay calm in this situation, or try to tell to the interviewer that okay, I will stay calm irrespective of the situation. I will not lose my cool or I will not get panic. Second most important is active listening. Listen to the patient concern. Why they are angry, why they are shouting, or why they are refusing for the treatment. Maybe try to understand the underlying cause. Maybe they are in pain, maybe they have fear, they have anxiety about the procedure, about their diagnosis, about the hospital stay. Anything can be there, right? So try to understand the reason and then try to rectify it if it is in your hand. Number 3, use polite communication. That is very, very important. Communication, compassionate approach, empathetic approach, soft skills are very, very important to use, especially in this kind of situations. Number 4, escalate this, right? It is also very important to escalate this for your security also, for patient security also, and for other patient security also. So you can escalate it to the security person. If the patient is very aggressive, you are not able to handle it, you can escalate it to your supervisor also, or you can escalate to the doctor. You can just say that I will follow the hospital protocols. Number 5, document. So documentation, no answer is complete without the documentation. Everything you have to document it. So see how easy it is. 5 steps you have to follow to answer this kind of behavioral questions. So always remember, aggression can never be you can never fight aggression with authority. Yes, it can be handled with empathy and control. Thank you so much. Follow Dynamic Academy for more such videos.